The outrage over the death of George Floyd continues to spread not only here in Canada, but around the world. Demonstrators were held today in London, Rome, and Madrid, just to name a few. Andrew Brennan has been following them all for us. Andrew, no matter where in the world, the message is the same.
Amanda, no matter the language they speak, the call for change is universal. Dozens of demonstrations have been taking place today, spanning continents, a unified message from people all over the world saying racism must be stopped, Black Lives Matter, and entrenched systems of oppression must be toppled. And their symbols, like what happened in Bristol in southwest England today. Anti-racism protesters dumped this statue of a prominent slave trader into the harbor. They pulled it down and rolled the statue of Edward Colston through the streets. Bristol was at one point a center for the slave trade and profited heavily from the transportation of slaves from Africa to the Caribbean and North America. There were also several thousands in the streets of London. Once again today, they gathered outside the U.S. Embassy and marched through the day. In Madrid, protesters knelt along their march to the U.S. Embassy. You're seeing here chanting "Police murderers" and "No justice, no peace." We move to Italy. People's Square was packed in Rome with the city's first major rally against racism, and also to Hong Kong. Organizers had called off the rally planned for today because of the city's coronavirus restrictions, but that didn't stop about 20 people showing up anyway to the U.S. consulate.
Well, this is actually a global issue. As much as it is an issue with the U.S., it is a global issue. People around the world will be looking at the U.S. and thinking to themselves that obviously black lives don't seem to matter that much, but we have to remind ourselves that despite all we see going on in the U.S. and in other parts of the world, black lives do indeed matter.
And Andrew, demonstrations also continue today elsewhere in Canada and the U.S.
Amanda, there are rallies across Canada again today, some underway right now, like in Victoria, BC, for instance. South of the border, America is seeing its 13th straight day of rallies in the wake of George Floyd's death in Minneapolis. Newly named Black Lives Matter Plaza near the White House has been filled with peaceful protesters all day. The National Guard and law enforcement largely withdrawn. The president reportedly wanting to deploy 10,000 troops to Washington last week. Top military officials opposed Donald Trump, however. In Buffalo, just yesterday, two police officers were charged for assaulting a protester, but those out today sent the message they were not backing down in their fight for racial justice. There were rallies in cities all over America, people marching, chanting, laying in the street, yelling, "I can't breathe," like George Floyd did, and he cried out as a white police officer had his knee on his neck for nearly 9 minutes. Now here in Quebec, we saw demonstrations in Sherbrooke and outside the National Assembly beyond Montreal today. In Mississauga, outside Toronto, hundreds were on the march, the peaceful demonstration calling for more police accountability. It was planned by student athletes from Sheridan College. And this was the scene further east in the Golden Horseshoe as one protester in Oshawa spoke directly to police in line before him.
Being a cop is about leadership, protecting and serving. So let's serve the underserved community and say, let's make an effort to mend the bridge, build the wall as a wall to bring us together. Let's end the violence, let's end the distrust, and let's build peace. That's all we want.
Hell yeah!
Well done. Well done.
Now, Amanda, this all comes as the body of George Floyd arrives in Texas today for a final memorial service and funeral. The ex-officer charged with second-degree murder in his death is set to appear in court tomorrow.
Yeah, and we will have more on that a bit later in the newscast. Thank you very much for that update, Andrew. That's Andrew Brennan up in our newsroom tonight.
The mayor of Montreal declared a state of emergency this afternoon. The measures are mostly for the homeless and how they can be protected from COVID-19. Andrew, the city wants temporary shelters set up.
Yes, Mitsumi, they're looking to have 5 set up in the next few days. The first we've heard of is going to be at Cabot Square, being run in part by Resilience Montreal, specifically targeting the Indigenous population that does frequent the area. They're looking to have about 1,000 people be housed in these new temporary shelters, and this is at the same time where normal shelters that have been in place in some cases for decades, over hundreds of years, are having to drop the number of beds. In some cases, it's dozens in each shelter, going down about 300 overall in those shelters. but 1,000 extras being added. Also, Guy Favreau complex and the Y downtown are being used to help with overflow, as the Royal Victoria Hospital, the old site, is now being used for the homeless to be tested particularly. Now, when we speak to homeless advocates, they say this is something they've been talking about having for weeks. And when you talk about the homeless population, if they're at risk, then that puts the entire population at risk. Now, a big challenge, though, will be getting the homeless people to go along with the system. Many do have mental health issues and are mistrustful of a lot of people. So we spoke with Matthew Pierce not long ago, and this is what he told us.
There's nothing easy about this. I don't think there's anything easy about COVID, but certainly when you think of the homeless population, this is going to be a challenge. Our staff, who know them well, the individuals that will be being treated, we know them well. We have techniques to help contain them and to give them a support to stay where they are or to get the services they need. And that's the same for organizations like Welcome Hall Mission, for Maison du Père, for Accueil Menot. We'll be there as well to support this new system.
Now, we have estimates, and they are several years old by this point, but we talk about 30,000 to 3,500 people that sleep on the street per night, and we're dealing with an additional 1,000 places for people to be safely kept inside and away from others and distance for COVID-19. So this is really just a drop in the bucket when we think about the homeless population at large. Now, speaking about Montreal in general, when we talked about 971 cases, we have now 4 confirmed deaths in Montreal. This is a 1 increase from the other day. We have 9 people that are in ICU, according to Montreal Public Health. Now, when we're speaking about the number of cases here, we still have about almost half, 42% of cases in Montreal are based on travel, and then 25% on top of that are people that have come in direct contact with them that are coronavirus cases. And then the rest, we don't know. We don't know the first point of contact for transmission. So that's why they're saying it's readily apparent that this virus is in the community. We've spoken about in the last few days how Côte St. Luc and other parts of the west of the city, NDG, are particular hotspots. So asking the Public Health Authority of Montreal today, they said that they're seeing things shift. It's been mostly the north and west side of the mountain before. Now we're seeing the plateau and Rosemont seeing more cases. So the maps of hotspots are shifting. Just a few other things to mention, just asking about how many people per 100,000. They gave us a bit of a ratio, some ratios here. So the general median for the island is about 25 to 35 people per 100,000 that have been infected with COVID-19 in the hotspots around the mountain, now going towards the plateau and Rosemont. We're talking about 150 to 200 people. We asked the mayor what this local state of emergency does mean. She says, well, there's a lot of other things about ensuring that Montreal police ensure that they have the authority to be able to stop people from continuing to not obey physical distancing orders, but the mayor was particular that most are listening. But she has said that this does not mean, and she wants to cut down any rumors that are circulating online, that Montreal and the island is on lockdown or in quarantine. She told us this a few moments ago.
The city is not under lockdown, nor is it in quarantine. Not today and not tomorrow. If this happens one day, it will be at the request of the government of Quebec and the Public Health Department. And if it happens, it will be done in a coherent and orderly way. We are not at that point at all.
Mitsumi, the mayor was asked if it will get to the point of blocking bridges or having police be ensuring that people don't come onto the island. She says that is maybe a worst case scenario, but we want to not get to that point. And just looking at all of these social distancing, physical distancing measures, isolation measures that we've been seeing put in place in the past close to 15 days or so since March 12th. Now, Dr. Mylène Drouin from Public Health says that we're not seeing the flattening of the curve that they've been looking for yet, but it's not at the point where we would be seeing direct results, but we have to be powering through and continuing to do what we're doing so we can stop this virus from spreading. Mitsumi.
Thank you very much, Andrew. And that's Andrew Brennan at Montreal City Hall.
In Quebec, public health officials remain on alert for COVID-19 and are monitoring the situation abroad, of course. The health minister gave an update on the situation late this afternoon. And Andrew, the province's first case was confirmed just last week, and they say the risk here does remain low, but they're prepared if that changes.
Yes, Caroline. Now, as you said, one confirmed case. 33 people are still under investigation, but in total, over 203 cases have already come back negative. The minister was joined today, Minister Danielle McCann, by a public health doctor looking at the saying they're going to be making weekly updates, more, they say, if necessary, if the situation changes. The big stressor here today was really on personal hygiene to help out the collective, calling it a collective responsibility, looking to mitigate the spread. Hand washing, very important. Coughing into the elbow, also, and disposing of tissues as soon as possible. Now, they're not the only measures being talked about here. They're also speaking of volunteer isolation, particularly if returning from hot spots like Iran and China. Now, on top of that, we do have, just looking at that one confirmed case, there's actually one of the healthcare workers that met this woman returning from Iran that is now also in volunteer isolation. This is being called an abundance of caution. The woman, as I said, coming back from Iran, she was not wearing a mask at all times while in the clinic, in the waiting room, and while in observation. Now, she went to the Jewish General Hospital earlier this week for further observation. They left the same day, though. As for things like greetings, as we've been talking about, and Cindy just mentioned, the traditional two-cheek greeting here in Quebec. Now, that is something that Danielle McCann says we need to be careful about, particularly with those more prone to illness. This is what she said a few minutes ago.
I think temporarily we should be very careful, and we'll come back to it later probably. But I think at this point it's safe to say that it's a good measure to especially with vulnerable people, older people, people who have illnesses. Let's be careful with them, especially.
So don't kiss them.
Send them.
Now, just in response to the outbreak that's, or rather the amount of cases being seen in the Greater Toronto Area, we looked at what the Toronto Transit Authority versus Montreal is doing, Caroline. Now, all streetcars, buses, and subways are being disinfected on a daily basis now in the GTA. We went to the STM to see what they had to say about what's being done here. In a statement, a spokesperson says the STM monitoring the situation closely, in close contact with public health officials like who we met today. Now, they say at least every week they aim to have all visible surfaces of the metro particularly being washed. This is including ticket dispensers and other areas of the metro stations, using different disinfectants on different target surfaces. They're also saying they're going to gradually establish a new interior train cleaning program using specialized products that will be rolled out. This will be rolled out in the next 7 days. As of right now, the interior surfaces of metro cars, Caroline, only being done about every 3 days. Now, when we spoke to Dr. Yves Jalbert of Quebec Public Health, he says 7 days may be a little long. This virus can actually stay alive on surfaces up to 6 days if they're wet, and a few days if not. So we wanted to see what Montrealers thought currently about COVID-19 as well, and how worried they are about this virus. The general consensus of the people we spoke to, they're being vigilant and they're not overall scared because the nexus of infections, as we've been mentioning, is so far away.
I'm not so concerned. I mean, obviously, internationally, everybody's very concerned about this. What they're telling us is to clearly wash your hands and use Lysol and things like that and sneeze into your arm.
Oh, of course I am concerned. Coming from Europe, it's actually over there it's a bit more significant than in North America, so yes I am.
You know there's more deaths just with the regular flu. I don't think I'm too concerned about this. No, not at all. I took the plane here, I wasn't worried. In the airports, nobody's wearing masks or anything like that.
Now, you see that first person particularly responding, showing that the message in some cases has come in loud and clear, but there are also a lot of myths and misconceptions about COVID-19. The last woman that you just heard there, she's one of the people saying that this novel coronavirus is about as dangerous as the flu, and that is not true. A WHO expert who led an internal mission to China to see how they were dealing with the outbreak there estimates the mortality rate will remain about 1% for COVID-19. Actually, right now, it's about 3.5%, but 1% is 10 times higher than the mortality rate for the flu in the general population in North America. So for viewers at home, you can stay up to date on COVID-19 by checking out ctvnews.ca. There's an entire section devoted entirely to the virus. Caroline.
All right, thanks. A lot of good information there, Andrew. Thank you very much.